Simonize is proud to introduce SaniCheck, a revolution in the world of hand hygiene compliance within the healthcare industry. Approximately 99,000 people die each year due to hospital-acquired infections, or HAIs. And those same hospital-acquired infections add an estimated additional $30 billion to hospital healthcare costs annually. SaniCheck is a low-cost solution emphasizing group compliance that is proven to increase hand sanitizing for the entire hospital staff and visitors, an innovation that reminds you if you forget to sanitize.
The number one thing we as healthcare workers can do to reduce the risk to patients being admitted to hospitals is sanitizing our hands. SaniCheck is designed as that last final step before you cross that portal as a reminder to the healthcare worker to sanitize their hands before entering the room. We implemented SaniCheck on our N3 medical unit, and we found a tripling of the rate of compliance with hand hygiene. So absolutely astonishing results.
SaniCheck gives healthcare providers the ability to drastically improve proper hand sanitation. Hand hygiene compliance isn't just good for the business of healthcare, it's good for the health of our patients.
Conscientious daily compliance, or CDC, as we like to call it, is essentially what SaniCheck is there to produce for us. You see, the healthcare workers know that they need to sanitize their hands. They want to sanitize their hands, and yet they sometimes forget. SaniCheck is there to assist them to do what we already know they are motivated and wanting to do: conscientious daily compliance. It's what we all want for our patients and loved ones.
SaniCheck reminds both visitors and staff to sanitize their hands upon entry and exit, reducing the risk of the spread of bacteria and increasing patient safety. When hospital employees or visitors enter a room without sanitizing, SaniCheck reminds them by emitting an audible tone accompanied by a red LED light. The user then places their hand beneath the simonized, in an instant, touch-free hand sanitizer dispenser. Once his or her hands have been sanitized, a green LED light is illuminated to communicate to everyone that the implementation of proper hand hygiene has taken place. Hospital staff and visitors quickly become comfortable with the gentle, consistent reminder that SaniCheck delivers upon every entry or exit to a room.
We've seen a reduction in our hospital of the rate of hospital-acquired infections that parallels the increase in compliance we've seen with hand hygiene compliance. So there seems to make sense that if you increase hand hygiene compliance, you decrease hospital-acquired infections. And SaniCheck has helped us to achieve this.
In addition to the consistent in-room reminders that help ensure compliance, SaniCheck collects 4 data points: total number of entries to a room, total number of compliant entries, total number of exits from a room, and total number of compliant exits. No personal identity information is collected. No badges are necessary. The data collected is anonymous and consistent, resulting in easy staff acceptance. Historically, most hospitals relied on direct observation by anonymous observers, so-called secret shoppers. This practice is still considered to be the gold standard. While this dated approach had some success, this type of observation is limited in scope, subjective, and inconsistent. SaniCheck provides direct observation electronically, 24 hours a day, 365 days a year. Secret shoppers observe a very low percentage of the group or visitors on a weekly basis. This is hardly scientific and is completely anecdotal.
It's important for everybody to follow the rules. The doctors, the nurses, the visitors, everybody. It then reminds you, whether you're a visitor or a nurse or a doctor, I need to go sanitize my hands.
SaniCheck is protected and driven by patent-pending proprietary software. All compliance data is stored in each SaniCheck unit and can be downloaded directly to a tablet through cutting-edge near-field technology that can then be uploaded to a secure web hosting network and accessed through a PC. Information can be held for as long or as short as you want. Results are easy to read and presented in reports that can be used to analyze the data in a variety of ways. Administrators can then utilize these reports to augment strategies and drive hand hygiene compliance to new levels. Installation and implementation is easy, with battery-powered SaniCheck units connecting directly to the dispensers. No badges or networks or ongoing operational support is required.
Here's the bottom line with SaniCheck. It's low cost, it's effective, and it's non-obtrusive. And what I mean by that is it's very accepting to the staff because it's simply a reminder system. It's not an expensive, difficult to install and maintain computer system or video system or RFID system where people are tracking the movements of the healthcare workers and trying to make a connection to who didn't comply. We trust that our employees want to do the right thing, will do the right thing. SaniCheck is a very, very inexpensive way to modify their environment to assist them to do what they already want to do.
To experience the real success of SaniCheck for yourself, contact Simonize today by visiting us online at sanicheck.org or calling 800-227-5536, extension 270. SaniCheck checks your germs at the door.